Somewhere around 1 in 3 adults worldwide is now living with a condition that, until fairly recently, most people had never even heard of, and that many still walk around with completely unaware they have, because it typically produces no symptoms at all until it has progressed significantly. Fatty liver disease, now more precisely called metabolic dysfunction-associated steatotic liver disease in updated medical terminology, though most people and even many doctors still refer to it by its older name, has quietly become one of the most common chronic health conditions on the planet, and its prevalence has risen so quickly over the past few decades that researchers have started calling it a hidden epidemic. What makes this particularly worth understanding is that the condition sits at a genuinely important crossroads. In many cases, it can be substantially reversed through specific evidence-based lifestyle changes, but if ignored, it can progress silently towards serious and sometimes irreversible liver damage, including cirrhosis and liver failure. Today, we're walking through what the science actually says is happening inside the liver when this condition develops, why so many common assumptions about it turn out to be incomplete or even wrong, and specifically what research supports as the most effective path toward reversing it. To understand fatty liver disease properly, it helps to understand what the liver is actually doing on a daily basis, because this context makes clear why fat accumulation there causes such disproportionate trouble compared to fat stored elsewhere in the body. The liver performs several hundred distinct metabolic functions, filtering toxins from the blood, producing bile essential for digesting fat, regulating blood sugar by storing and releasing glucose as needed, producing proteins essential for blood clotting, and metabolizing virtually every nutrient, medication, and substance that enters your body through the digestive system, since blood from the intestines flows directly to the liver before reaching general circulation. Fatty liver disease occurs when fat, specifically a type of fat called triglycerides, accumulates within liver cells beyond a certain threshold, generally defined in research and clinical practice as more than 5 to 10% of the liver's weight consisting of fat. Because this fat accumulation happens within the very cells responsible for all those hundreds of metabolic functions, even modest fat buildup can begin interfering with the liver's ability to do its job properly. And research has shown that this interference triggers a cascade of consequences that extend well beyond the liver itself, affecting blood sugar regulation, cholesterol metabolism, and systemic inflammation throughout the entire body. One of the more important shifts in scientific understanding over the past decade involves recognizing that fatty liver disease is not, as it was long assumed to be, primarily a disease of people who drink heavily, a category that does exist and is properly called alcohol-related liver disease, but rather a distinct and now far more common condition strongly linked to metabolic factors like insulin resistance, obesity, and elevated blood sugar, occurring in people who drink little or no alcohol at all. This distinction matters enormously because it means many people who assume their liver couldn't possibly be affected since they don't drink or drink only lightly are in fact among the population at genuine risk, and research has found that this metabolically driven form of fatty liver disease is now dramatically more common than the alcohol-related form in most populations studied. Another important scientific development involves understanding that fatty liver disease exists on a spectrum rather than being a single fixed condition. At the earlier and more common end of this spectrum sits simple fatty liver, where fat has accumulated but significant inflammation or damage has not yet occurred, a stage that research has found is often substantially reversible through lifestyle intervention. Further along this spectrum sits a more serious stage called steatohepatitis, where the accumulated fat has triggered genuine inflammation and cellular damage within the liver. And if this inflammatory process continues unaddressed over years, it can lead to fibrosis, meaning scarring of liver tissue, and eventually to cirrhosis, a serious and largely irreversible stage where extensive scarring significantly impairs liver function and substantially raises the risk of liver failure and liver cancer. Understanding where someone sits on this spectrum matters enormously for how urgently intervention is needed, which is part of why proper medical evaluation, typically involving blood tests and imaging, and in some cases specialized tests that can estimate the degree of liver scarring without requiring an invasive biopsy, has become an increasingly important tool in managing this condition effectively. Now let's talk about what the research actually says works, because this is genuinely one of the more encouraging areas in all of chronic disease management. Since unlike many conditions where damage once done cannot be undone, the earlier stages of fatty liver disease have been repeatedly shown in research to be substantially reversible, sometimes remarkably so, through specific and well-studied interventions. Weight loss stands as the single most extensively researched and most effective intervention for fatty liver disease. And the research here is unusually precise about exactly how much weight loss produces exactly what degree of benefit, which is genuinely useful information rather than vague encouragement to simply lose weight. Multiple studies, including ones that used liver biopsies to directly measure changes in fat content, inflammation, and fibrosis, have found a fairly consistent dose-response relationship. Research has shown that a weight loss of around 3 to 5% of body weight produces measurable reductions in liver fat content. Weight loss in the range of 7 to 10% has been shown to significantly improve or resolve the inflammatory changes characteristic of steatohepatitis in a substantial proportion of patients studied, and more substantial weight loss, generally exceeding 10%, has been associated in research with meaningful improvement or even reversal of fibrosis, the scarring stage that was previously assumed to be largely permanent. This finding, that even fibrosis shows meaningful reversal potential with sufficient and sustained weight loss, represents one of the more genuinely hopeful developments in this field of research over the past 15 years, since it challenges the older assumption that liver scarring, once present, was essentially a one-way street. What's particularly important about this research is that it doesn't require dramatic or extreme measures. A 5 to 10% reduction in body weight for most people represents a realistic, achievable target through sustainable dietary and activity changes rather than an extreme intervention. And researchers studying this consistently emphasize that gradual, sustained weight loss, generally in the range of about half a kilogram to a kilogram per week, tends to produce better and more durable liver health outcomes than rapid, aggressive weight loss approaches, some of which have actually been associated in certain studies with temporarily worsening liver inflammation, likely related to the rapid mobilization of fat and associated metabolic stress that occurs with very aggressive caloric restriction. Dietary pattern, independent of weight loss itself, has emerged as its own significant area of research, and the evidence here has increasingly converged around a few specific and consistent findings. Reducing intake of added sugars, particularly fructose consumed through sugar-sweetened beverages, shows a particularly strong and specific relationship with liver fat in research, for reasons connected to how the liver processes fructose that we've touched on in other contexts. Fructose is metabolized almost exclusively within the liver itself, and when consumed in the large quantities typical of modern sugar-sweetened beverage intake, this concentrated metabolic burden directly promotes fat synthesis within liver cells in a way that more evenly distributed carbohydrate sources generally do not to the same degree. Multiple studies have found that reducing or eliminating sugar-sweetened beverages specifically produces measurable reductions in liver fat, sometimes within a matter of weeks, making this one of the more specific and high-leverage dietary changes the research points to for this particular condition. The Mediterranean dietary pattern, built around vegetables, legumes, whole grains, olive oil, and fish, with limited red meat and processed food, has been studied extensively in relation to fatty liver disease specifically, and multiple randomized controlled trials have found that adherence to this dietary pattern produces significant reductions in liver fat content, independent to some degree of overall weight change, suggesting the specific composition of the diet, not just its calorie content, matters for liver health. Researchers believe several components of this dietary pattern contribute. The healthy fats found in olive oil and fish, particularly omega-3 fatty acids, have been shown in research to have anti-inflammatory effects relevant to the inflammatory processes driving disease progression. The high fiber content from vegetables, legumes, and whole grains supports the gut microbiome in ways increasingly linked to liver health through what researchers call the gut-liver axis. And the overall reduction in processed food and refined carbohydrates reduces the kind of rapid blood sugar spikes that contribute to the insulin resistance so closely tied to fatty liver disease development. Physical activity represents another well-researched intervention. And importantly, research has found that exercise produces meaningful reductions in liver fat even independent of significant weight loss, meaning the benefit is not purely a downstream effect of losing weight, but appears to involve direct effects of exercise on liver metabolism itself. Studies comparing different types and intensities of exercise have found that both aerobic exercise and resistance training independently reduce liver fat, with some research suggesting that higher intensity aerobic exercise may produce somewhat greater benefit per unit of time compared to lower intensity activity, similar to patterns observed in research on visceral fat, which makes sense given how closely liver fat and visceral fat are metabolically connected within the body. What's particularly encouraging about the exercise research specifically is that studies have found meaningful reductions in liver fat with as little as 150 minutes of moderate intensity exercise per week, an amount that aligns with general physical activity guidelines rather than requiring an extreme or specialized exercise regimen. Though, as with weight loss, more exercise generally correlates with greater benefit up to a point. Addressing insulin resistance directly represents another important angle the research has clarified. Since insulin resistance and fatty liver disease are so closely intertwined that many researchers now consider them to be, in a meaningful sense, two manifestations of the same underlying metabolic dysfunction, each capable of driving and worsening the other. This is part of why research has found particular benefit from dietary and exercise approaches that specifically improve insulin sensitivity, including reducing refined carbohydrate intake, maintaining regular physical activity, which independently improves how effectively muscle tissue responds to insulin, and in some cases, medications originally developed for diabetes management that improve insulin sensitivity have shown benefit for liver fat in clinical trials specifically involving patients with fatty liver disease, an area of active and evolving pharmaceutical research that has produced some genuinely promising results in recent years, including medications specifically developed and approved for treating more advanced stages of this condition. Alcohol deserves specific mention here, and the research creates an important nuance worth understanding clearly. For people with alcohol-related liver disease, avoiding alcohol entirely is unambiguously the primary and most important intervention, well supported across decades of research. But even for the metabolically driven form of fatty liver disease we've spent most of this discussion on, research has found that regular alcohol consumption, even at levels sometimes considered moderate in other health contexts, can worsen liver fat and accelerate disease progression, since alcohol places additional metabolic burden on a liver already struggling with fat accumulation and inflammation. This is part of why current clinical guidance for anyone diagnosed with fatty liver disease of any type generally recommends significantly limiting or eliminating alcohol intake, even in cases where the underlying cause is clearly metabolic rather than alcohol-related in origin. Coffee consumption represents one of the more surprising and consistently replicated findings in this area of research, and it's worth mentioning because it runs counter to what many people might intuitively expect. Multiple large observational studies and some mechanistic research examining possible explanations have found that regular coffee consumption, generally in the range of 2 or more cups daily, is associated with lower rates of liver fibrosis and slower disease progression in people with fatty liver disease, an association that is held up across numerous studies conducted in different populations. Researchers have proposed several possible mechanisms, including specific compounds in coffee that appear to have antioxidant and anti-inflammatory effects within liver tissue, though it's worth noting this research is primarily observational in nature, meaning it establishes a strong and consistent association rather than definitively proving direct causation. And coffee should be understood as a potentially beneficial addition alongside the more rigorously established interventions we've discussed, rather than a replacement for them. Bringing this all together, what the current body of research points toward is a genuinely hopeful and actionable picture for a condition that affects an enormous number of people, many without even knowing it. Modest sustained weight loss in the range of 7 to 10% of body weight, a dietary pattern that specifically reduces added sugar and emphasizes whole foods along the lines of the Mediterranean pattern, regular physical activity combining both aerobic and resistance exercise, limiting alcohol intake, and possibly incorporating regular coffee consumption, together represent an evidence-backed approach that has been shown, across numerous well-designed studies, to meaningfully reduce liver fat, resolve inflammation, and in many cases even improve or reverse fibrosis that might otherwise have been assumed permanent. Perhaps the most important message from this entire body of research is one of genuine agency in the face of a condition that can otherwise feel abstract and invisible, precisely because it produces so few symptoms until it has progressed significantly. Fatty liver disease is not simply something that happens to you and must be passively managed or monitored. For the substantial majority of people, particularly those caught in the earlier stages of the disease spectrum we discussed, it responds meaningfully and often quite quickly to specific, well-understood changes in daily habits, changes that overlap considerably with what supports overall metabolic health more broadly. For anyone who suspects they might be at risk, given how common risk factors like excess weight, elevated blood sugar, or metabolic syndrome are, or who has already received this diagnosis, the research is genuinely clear that speaking with a healthcare provider about proper evaluation and a personalized approach along these evidence-based lines represents a meaningful and often highly effective path forward, rather than something to quietly worry about without taking action. It's worth spending a moment on how this condition is actually detected in the first place, because so many people first learn about their own liver health almost by accident, through blood tests ordered for an entirely different reason. Elevated liver enzymes, particularly ones called ALT and AST, often show up on routine blood panels before any symptoms appear, and research has found that a meaningful proportion of people with fatty liver disease are first identified this way, through a slightly abnormal number on a standard checkup, rather than through any complaint they brought to their doctor. This is precisely why the condition has earned its reputation as a silent disease, and why researchers increasingly advocate for proactive screening in people with recognized risk factors, including excess weight carried around the abdomen, type 2 diabetes or prediabetes, elevated triglycerides, and metabolic syndrome more broadly, rather than waiting for symptoms that, in many cases, only appear once the disease has already progressed to a more advanced and less reversible stage. Beyond blood tests, imaging techniques have become increasingly important diagnostic tools, with ultrasound often serving as an accessible first step for detecting fat within the liver, while more specialized imaging techniques, including a technique called elastography that can estimate the stiffness of liver tissue as a marker of scarring, have given clinicians a way to assess fibrosis without needing to perform an invasive liver biopsy in many cases. A genuine advance in how this condition can be tracked over time as someone works through the lifestyle changes we've discussed. Sleep also deserves mention in this discussion, since research examining the relationship between sleep quality and metabolic liver health has found some genuinely relevant connections. Studies have identified associations between poor sleep quality, shortened sleep duration, and increased risk of fatty liver disease, and separately, obstructive sleep apnea, a condition involving repeated pauses in breathing during sleep that becomes considerably more common in people carrying excess weight, has been specifically studied in relation to liver health, with research finding that the intermittent drops in oxygen levels characteristic of untreated sleep apnea appear to worsen liver inflammation independent of weight alone. This has led some researchers to recommend that people diagnosed with more advanced fatty liver disease, particularly those also dealing with excess weight and unexplained daytime fatigue, be evaluated for sleep apnea, since treating that underlying sleep disorder has shown some benefit for liver health outcomes in the research examining this specific connection. It's also worth touching briefly on the role of specific dietary fats, since not all fat sources appear equal in this research, despite total fat sometimes being treated as a single undifferentiated category in older nutritional thinking. Saturated fat, found concentrated in sources like processed meats, butter, and many fried foods, has been associated in multiple studies with less favorable liver fat outcomes compared to unsaturated fats, particularly the monounsaturated fat found abundantly in olive oil and the omega-3 polyunsaturated fat found in fatty fish, both of which show more favorable associations with liver health in the research literature. This distinction reinforces why the Mediterranean dietary pattern discussed earlier tends to outperform generic low-fat diets in liver-focused research, since it doesn't simply reduce total fat intake, it specifically shifts the composition of that fat toward the types the evidence associates with better outcomes, while simultaneously reducing the added sugar and refined carbohydrate intake that independently drives liver fat accumulation through the mechanisms discussed earlier. Taken as a whole, the picture that emerges from this research is remarkably consistent with what tends to support metabolic health more broadly. Meaningful weight management, a diet built around whole foods with limited added sugar and thoughtfully chosen fats, regular movement that combines both aerobic and resistance elements, adequate and good quality sleep, and moderation around alcohol. What makes fatty liver disease specifically worth understanding on its own terms, rather than simply folding it into general health advice, is how directly and measurably the liver itself responds to these changes, and how much scientific evidence now exists showing that this response includes not just prevention of further damage, but genuine reversal of damage many people would once have assumed was permanent.